Welcome to the RX class. I'm your host, Dr. Guang Chen. Today I'll be talking about medication safety. You might wonder, what's so dangerous about medications? Let me give you some frightening statistics. 7 out of 10 adults aged over the age of 40 have used one prescription drug in the last 30 days. And 1 in 5 has used at least 5 prescription medications in the last 30 days. These numbers increase as we age, as well as if you start to collect chronic diseases. For anyone who has had a heart attack, you will know that you would have went in with 0 medications and you probably left with 4 or 5. Now, what's more frightening is that 1/3 of patients do not take the medications as they're prescribed or directed. And so that means that some patients take more than they need, take less than they need, or don't take them at all. Medication-related harm is an important cause of hospital presentation and hospital admission. Up to 3% of all hospital admissions can be attributed to medication harm. This number increases if you're elderly or if you're taking multiple medications. To better understand medications, I'd like to present a couple of very simple principles that will become important in later podcasts. So firstly, I'd like to talk about what is a medication. I take all medications as a substance when taken, applied to the body, injected, that causes a measurable effect. And so, for example, if you were to take a diabetic medication, we should be able to measure a change in blood glucose. If you take a pain medication, we should be able to detect a decrease in pain score. The current medication approval process is all about measuring these outcomes. You may have heard on the news or reports talking about clinical trials. So let me give you a rundown of what clinical trials are. Clinical trials are divided into various phases. We start with, in actual fact, preclinical trials. Clinical usually means the use of human subjects, and preclinical means prior to human subject testing. And this usually includes testing in a test tube or testing in animal models. In actual fact, very few medications leave this to become possible candidates in clinical trials. Clinical trials are then divided into 3 or 4 phases. In phase 1, the main aim is to test for safety. And so in general, small numbers of healthy patients, occasionally they may include patients who have the particular disease that they're examining. They're given various doses to look for serious side effects. Then we move on to phase 2 trials. Safety testing continues, but phase 2 is really about looking at efficacy, or if the medication works. In this particular phase, more patients are recruited, they have the condition, and they're often given multiple doses to see which particular dose may be the best. Then we move on to phase 3 clinical trials. These are the largest trials. They often involve hundreds, if not thousands or tens of thousands of patients. You may have heard the word a double-blind randomized controlled trial. Let's go through these words individually. Double-blind means that both the patients taking the medications do not know whether they're taking placebo, which is a sugar pill, or the medication, nor do the investigators. That's the doctors giving them the medications and also taking information at regular intervals. The only person that knows is the pharmacist who makes up the medications. And this information is held secretly. Randomized means that when patients are selected into the trial, the computer system generates whether they go on to placebo or whether they take the active ingredient. Again, this information is only known at the computer system level. Clinical 3 trials are very important because the information that is obtained makes or breaks a drug. And this is because all drug approval authorities across the world use phase 3 clinical data to approve a medication. And then lastly, you may have heard about phase 4 trials. These trials occur after the medication has been approved, and often we call these post-marketing. Now next, let's look at medication names. Medication names can be divided into brand names versus generic names. Let's start with generic names. The generic name of a medication is the actual scientific name of this medication. And most medications in the same group will share a similar word ending. For example, a group of medications for cholesterol, which we call statins. The family includes atorvastatin, pravastatin, simvastatin, rosuvastatin, just to name a few. Similarly, a group of medications called proton pump inhibitors, or commonly known as reflux medications, share the ending prazole. We have pantoprazole, rabeprazole, lansoprazole, omeprazole, esomeprazole. You get the picture. So what is the difference between generic name and brand name? As I said, the generic name is the chemical substance, whereas the brand name, typically the original brand name is given by the first manufacturer with the original patent. These names are much easier to remember and often are only 2 or 3 syllables. Here are some of the famous ones. I remember the first time I heard about furosemide, or in America it's known as furosemide. The original brand name is called Lasix. And Lasix is actually short for lasting for 6 hours, because that's the duration of action. Other famous names include Ambien, which is a sleeping tablet. It's made up of the word AM, morning, and bien, meaning good in Spanish. Other interesting names include Lopressa, low blood pressure, and it's a blood pressure medication. Okay, now lastly, I like to talk about the cost of medications. Now, this is quite a controversial topic, but the cost of medication is very variable across different countries and jurisdictions. But to understand the cost of medication, one has to understand if the medication is under patent. And typically, most patents last 20 years, and within that patent period, that company has the sole right to sell and market this particular medication. Now, as we talked about before with the clinical trials, currently the cost of bringing a medication to market is several billion, if not tens of billions of dollars. And for the company to recoup the costs, they may need to sell the medications at a very high cost. Now, it's unlikely that the standard consumer will be able to afford these prices, and so these medications become subsidized. Depending on the country, let me use the example of Australia. The government may choose to subsidize a medication, and when it does so, it takes on the majority of the cost of a medication, and the patient only pays a small copayment. Let me give an example. Of my patients who have inflammatory bowel disease, some of these patients are on biologic monoclonal antibodies. These medications in Australia, if you did not have subsidy, cost 20 to 30,000 Australian dollars. Now, these medications are much more in the United States, but that's another story. Because these medications are subsidized, the patient only pays a $30 copayment per month. Next, we come to generic medications. So generic medications is different to the generic names of the medications. Generic medications are medications that are made once the patent expires. Generally speaking, when generic medications come online, the overall price of this particular medication drops significantly. Lastly, I'd like to talk about some basic concepts of the chemical effects of the drugs. Firstly, I'd like to talk about the pharmacodynamics. So D for drug effects. The pharmacodynamics describe the effects and side effects of drugs on the body, including its effects on driving, drowsiness, pregnancy, breastfeeding, other medication effects, whereas pharmacokinetics is what the body does to the medication. And this includes the absorption, distribution, breakdown, elimination of the medication. This will be determined by a patient's weight, gender, ethnicity, and current medical conditions, and other medications, just to name a few. Just to summarize today, we've talked about medication safety. I've given you some statistics about medication safety. I've also given you some important background information that will become useful in future episodes. Before we finish today, let's go through an example. I've downloaded a CMI, which is a Consumer Medicine Information Sheet for a diabetic medication. Before I'd start, I'd like to say that this is not a medication that I usually prescribe, and I'm using this as an illustrative and educational purpose only. Please do your own research before starting this medication. If you have questions, please speak to your specialist or general practitioner. So the medication I'm going to be talking about is brand name Jardiance. In Australia, the CMI or Consumer Medicine Information has a standard format. There is a first page summary and several other pages with additional details. I'll be covering some of the concepts we've talked about, and hopefully you'll be able to use this next time. You can usually obtain the CMI inside the package of your medication. If you don't find it, your local pharmacist can download one for you, or you can always find one on the internet. So let's use Jardiance as an example. The first page, it's divided into several sections. The first section is why am I using Jardiance? It's important to know that the CMI is always written in plain English. While there are some technical words, hopefully most of the information is easily understandable. So let me read you this description for Jardiance. Jardiance tablets contain the active ingredient gliflozin. This is the generic name. Jardiance is used to lower blood sugar levels in people with type 2 diabetes mellitus. Jardiance can be used to help lower the risk of dying from cardiovascular disease in patients with type 2 diabetes mellitus and cardiovascular disease. Jardiance is also used with other medications to treat heart failure and to slow the progression of kidney disease in patients with or without type 2 diabetes mellitus. So these 3 or 4 things listed here are what we call the indications for the medication. So these are the intended purposes for this particular medication, Jardiance or empagliflozin. Some patients may be prescribed medications off-label, and what that means is that they are not officially listed, but may be helpful in special circumstances. So please speak to your doctor when they prescribe a medication off-label. The second section talks about what should I know before I use Jardiance. So this is usually information about problems that you may encounter even before you take the medication. So let me read you this particular part. Do not use if you ever have had an allergic reaction to empagliflozin or any other ingredients listed at the end of the CMI. So this is, the listed ingredients are what we call excipients or additives. You might not know, but the actual active ingredient only takes up a microscopic part of each tablet. The rest is made up of filler. And so, for example, with this particular medication, when we go back to the end, we see that the active ingredient is gliflozin, which is only 10 milligrams, followed by lactose, monohydrate, microcrystalline cellulose, etc., etc., etc. You get the picture. And then there's also the ingredients for the tablet coating: hypromellose, titanium dioxide, purified talc, Racogol 400, iron oxide yellow, and it lists the potential allergens, lactose. Further on from section 2, talk to your doctor if you have any other medications, if you have any other medical conditions, take any other medications, or are pregnant or plan to become pregnant or are breastfeeding. This refers to the information that we spoke about before, which is about the pharmacokinetics and pharmacodynamics of the medication, in the sense that this medication can affect other body systems, pregnancy, lactation. Similarly, a person's individual medical conditions as well as other medications can also affect Jardiance itself. Section 3, what if I'm taking other medications? Some medications may interfere with Jardiance and affect how it works. A list of these medications is listed in Section 3 of the 4PMI. And this is an additional part of Section 2. Section 4, how do I use Jardiance? So in this particular section, it gives the most common way of taking the medication. Your doctor will tell you how many tablets you'll need to take each day. The usual dose for adults is 1 tablet a day. More instructions can be found in Section 4. Occasionally here may also include information about whether tablets can be taken with meals or on an empty stomach. Section 5. What should I know while taking or using Jardiance? It's got a couple of sections: things you should do, things you should not do, driving or using machines, drinking alcohol, looking after your medication. This section includes useful tips while you're taking the medication, especially about storage of the medication, as well as any effects while driving or using machinery. It also gives information about whether you can stop the medication suddenly, as well as important things you can measure at home. In particular, because this is a diabetic medication, you can check your sugars regularly at home. Lastly, is a summary of side effects. Are there any side effects? Common side effects include genital burning, redness, pain, discharge, passing more urine than normal, thirst, itchiness, and constipation. Serious potential side effects that may require medical attention include low blood sugar when used in combination with other anti-diabetic medications, dehydration, burning sensation when passing urine, cloudy urine, straining or pain when passing urine, the pain in the pelvis or mid-back. Side effects that require urgent medical attention include swelling of the genitals, Fournier's gangrene, allergic reaction, and ketoacidosis. For more information, including what to do if you have any of these side effects, see section 6. And so this is a very important section as it talks about common side effects, serious side effects, and very serious side effects. In terms of the frequency of these effects, it's not listed here, but I'll come back to it a little bit later. It is included in the product information. If we go on to the next couple of pages, there are additional information about Jardiance. So, for example, section 1, it gives some pharmacological information about how the medication works. For example, Jardiance or empagliflozin is a group of medicines called sodium glucose cotransporter 2 inhibitors. It works on blocking the protein in kidneys called SGLT2, and removes blood sugar via the urine. As a result, the levels of sugar in your blood are reduced. Jardiance also reduces the amount of salt reabsorbed by your kidneys, which helps reduce excess strain on the heart. Jardiance may also help protect your kidneys from further damage caused by high blood sugar levels and excess strain on the heart. This gives you the scientific understanding of the indications or the intended purposes of Jardiance. Furthermore, additional information, for example, of how do I use Jardiance here, it tells us that it does not matter if you take Jardiance before or after food. How to take Jardiance, swallow the tablet whole with a full glass of water. It also gives additional information about if you forgot to take the medication or you miss a dose, what to do. So in this particular situation, if you miss your dose at the usual time and it is almost time for your next dose, skip the dose you missed and take your next dose when you are meant to. Otherwise, take it as soon as you remember and then go back to taking your medication as you would normally. Something that may be relevant in certain parts of the world, but not so much in Australia, which is usually not related to Jardiance perhaps here, but other medications that may be counterfeited. And so at the bottom, there's a description of the medication. Jardiance 10 milligram tablets are pale yellow, round, bioconvex, and bevel-edged, marked with the BI company logo on one side and S10 on the other side, and a similar description for the 25 milligrams. I did mention briefly about the product information. The product information is a document produced by the drug company for doctors only. It contains essentially very similar amounts of information as the consumer medicine information. However, it has additional information about the clinical trials, especially of new medications that were approved in the last couple of decades. And that's helpful if you want to understand the science behind some of the trials. The other helpful section is with regard to the side effects. And there are definitions for example, common or very common versus rare, and also definitions of serious and very serious. I hope you enjoyed our third episode. I'll see you next time.